Second white coat. Subscribe and like. Let's learn medicine together.
All right, welcome back. Today, we're going to play medical detective. We've got a case that starts with what looks like a simple car crash, but trust me, it quickly spirals into a really complex brain mystery. It's a perfect example of how one single injury can kick off a super dangerous chain reaction.
So that brings us to our big question, right? How on earth can a simple neck fracture lead to a complex brainstem stroke? I mean, it sounds like a huge leap, doesn't it? But all the clues are there, kind of hidden in the body's super intricate wiring. And together, we are going to piece this puzzle together.
And like any great mystery, this whole thing kicks off with something that seems totally straightforward, just on the surface. But yeah, lurking just beneath all that is a problem that is way, way more serious than anyone first thought.
Okay, so our story starts with what looks like a pretty standard ER visit, but there's a hidden danger here.
So let's meet our patient. He's a 29-year-old guy, and he's been brought into the ER after a car crash. The main things he's complaining about are a really bad headache and some serious neck pain. I mean, so far, this sounds pretty much like a textbook trauma case, right?
So the first look at him is actually pretty reassuring. But then, the imaging reveals something absolutely critical. And here it is, our first big clue on this MRI from day one. He's got a fracture in his C2 vertebra. That's one of the highest bones in the neck. Now, for the doctors, this isn't just any fracture. The source I'm looking at literally calls it a huge vascular red flag. So why? Why is that? Well, it's because a super important artery, one that feeds the brain, runs right through that exact spot.
Okay, so now let's see how this one red flag turns into a massive neurological puzzle. So while he's in the hospital recovering, the whole situation just takes this sharp, totally unexpected turn. All of a sudden, he develops this cascade of really bizarre symptoms that seem to come out of absolutely nowhere, and his doctors are left, scrambling to figure out what is going on. So the clues start to pop up one by one. First, he gets dizzy, and he's got nystagmus. That's where your eyes start moving uncontrollably. Then, his voice gets all hoarse. He also develops ataxia, which means he's having a really hard time with coordination. Simple stuff like touching his finger to his nose. He even gets a partial droopy eyelid that's called ptosis. I mean, it's just this really strange mix of problems that, at first glance, don't seem connected at all. But out of all these weird clues, one of them really stood out. It was the most baffling, and ultimately, it was the key to cracking the whole case. It's this thing called crossed sensory loss. So, what does that even mean, crossed sensory loss? Well, get this. The patient lost the feeling of pain and temperature on the right side of his face, but on the complete opposite side, the left side of his body. Now, this isn't just weird, it's a super specific neurological sign that points like a laser beam to a problem in one very precise spot in the brain.
And this brings us right to the heart of the mystery. The team starts thinking, okay, this has to be an arterial dissection, which is basically a tear inside an artery's wall. So given this very unique, very specific set of symptoms, they had one huge question to answer. A dissection of which artery could explain all of this?
To find that answer, you can't just look at the whole brain. We have to zoom way, way in. The investigation really begins by mapping the brainstem, trying to find the exact location of the damage.
In this diagram right here, this is our crime scene. It's a tiny but unbelievably important part of the brainstem called the lateral medulla. The best way to think about it is like a super busy highway intersection where all the wiring for these different functions has to pass through. And as we're about to see, every single one of our patient's bizarre symptoms points right to this one spot.
Okay, so let's actually connect the dots. That hoarseness, that's from damage to a spot called the nucleus ambiguus. The dizziness and the eye movements, the vertigo and nystagmus, yep, that's the vestibular nuclei. What about the coordination problems, the ataxia? That traces right back to the inferior cerebellar peduncle. The face numbness, that's the spinal trigeminal nucleus. And that super weird crossed body numbness, that comes from the spinothalamic tract. You see, every single symptom maps perfectly to a structure inside that tiny lateral medulla.
So here's the kicker. This very specific combination of signs, it's not random at all. It actually has a name. It's a classic diagnosis called lateral medullary syndrome, or sometimes Wallenberg syndrome. So, boom, we found the location of the problem.
Okay, so now that we know where the damage is, we can get to the next part of the investigation, figuring out the cause.
What actually cut off the blood supply to this supercritical area?
And that leads us to the most logical next question. Which artery is supposed to be feeding the lateral medulla?
The answer is the posterior inferior cerebellar artery, which thankfully everyone just calls PICA for short. Now, here's the really critical part. The PICA is just a branch off of a much bigger vessel, the vertebral artery. And where have we heard about that area before? Well, the vertebral artery runs right up through the neck, and it passes directly through that fractured C2 vertebra. You can almost hear the pieces clicking into place now, can't you?
And this is basically a process of elimination. It shows why the vertebral artery is really the only suspect that fits the crime. I mean, think about it. A stroke in the MCA, the middle cerebral artery, that would give you face and arm weakness. A PCA stroke, you'd have vision problems. A basilar artery stroke, that could cause something terrifying like locked-in syndrome. None of those fit our patient. The only thing that explains it all is a problem with the vertebral artery that messes up its pica branch. It is a perfect match.
All right, we are ready to put this whole thing together. It's time to connect that very first injury all the way to the final diagnosis. We're calling it the Wallenberg connection.
Okay, so here's the whole chain of events, from A to Z. The neck trauma from the car crash, that causes the C2 fracture. That fracture then damages and tears, or dissects, that vulnerable vertebral artery that's passing right through it. So now that dissection cuts down the blood flow to the PICA. And because the PICA isn't getting enough blood, it starves the lateral medulla of oxygen, and that causes an infarct. In other words, a stroke.
And if we look at our diagram just one last time, you can see the entire story laid out. A problem that started way down here in the neck with the vertebral artery. It traveled all the way upstream and caused a complete shutdown in this little command center in the brainstem. It's just a direct and honestly a devastating connection.
So, the big takeaway from this whole case, it can really be boiled down to a simple but super memorable rule for clinicians. Neck trauma plus dizziness plus hoarseness plus those classic crossed symptoms, that equals a vertebral artery emergency. It's a simple equation, but it's one that can absolutely save a life.
You know, this whole incredibly complex case started with an injury that could have been so easily overlooked. And that kind of leaves us with one final, pretty provocative thought, right? What other seemingly harmless injuries out there could be hiding a major medical emergency, just waiting for someone to spot the right clues?